Hi! So it made me so happy that people liked the lip filler video I made because I was kind of nervous about posting something that was that transparent. And I hadn't seen any other videos like that. So it made me really happy that my friends liked it and appreciated it. So I decided I'd make one about Botox because a lot of people have a lot of questions and they don't really understand what it is. But I just wanted to say, you know, me making these videos and posting it, it's not because I think I know everything on the subject or because I think I'm the best. That could not be farther from the truth. I have so much to learn. I'm still a new injector and I'm constantly reading and watching videos and stuff like that. So I don't want to give the impression that I am some sort of expert and that's why I'm making these videos, because that is not the case. The truth is, it just makes me so happy when I see specifically women's confidence boost, whether that because they have more knowledge on a subject, like learning about this kind of stuff, or because of a treatment that we did, makes them feel more beautiful on the outside, and then it boosts their confidence. That is why I do this. I love it so much. So I really loved all the questions. They were all really, really good questions. Some of them are more specific, so I'm going to reach out to some of you one-on-one because just for sake of time, it'd be hard to cover everything. So I'm going to try to focus on like the main areas and the main reasons people get Botox. What do people mean when they say, I want to get Botox? Botox is just one brand name of the botulinum toxin. So it's like saying Band-Aid instead of bandage, or Kleenex instead of a tissue. It's just a brand. There are other brands like Dysport, Jeuveau, Xeomin. They're all essentially the same thing. You get the same effects, but they have some slight variations. Which one you get really just depends on the injector's preference. And then sometimes there's clients who have a preference that, you know, they've noticed, you know, that certain ones they feel work better for them than others. Because of this, you might hear injectors refer to it as toxins or tox instead of using the term Botox, because we use different brands, different toxins. So, but for the most part, you know, people just kind of say Botox because that's by far the most famous one and the one that people know. So what is it? What does it do? Well, it's a neurotoxin, and literally what it does is it temporarily paralyzes the muscle that it's injected to, which is kind of crazy. It lasts 3 to 4 months depending on how quickly you metabolize through it. Everybody's different. Your bodies are different. But why would we want to paralyze a muscle? Well, because when we make facial expressions, we flex or we move these muscles in our face and they make little lines. Now, I've recently had Botox here and here, so you're not going to really see much when I do this. So I'm going to pop some pictures in to kind of show you what I mean. But I haven't Botoxed from here down. So when I smile, you can see all these lines here. That is the crow's feet area. So, you know, right now, they're only really visible when I smile. They're not really visible when I'm not having any movement. So that's actually when toxins are more effective for treating. So a lot of times people will say, oh, you don't need Botox. You're making those lines appear. You only have those lines when you make those faces. Well, that's really when you want to do it. Because once the lines are there all the time, even when you're not making the face, they're more difficult to treat, meaning we can still treat it and we can most definitely soften that line, but we may not be able to totally get rid of it because the line's there all the time, not as a result of muscle movement. So therefore, paralyzing the muscle isn't going to make that line go away. So I've made the mistake of offering to inject friends or family, not realizing that people think that Botox is for like old people, and they say, oh, well, oh, you think I'm old. And that's really not. I mean, once you get to the point where the skin is very wrinkly, it's not really gonna be much of a benefit at that point. At that point, you're thinking like a surgical facelift would be more of a treatment for that. So if you've ever heard, now it's the thing, people in their 20s, girls in their 20s, and guys are getting Botox as a preventative treatment. And it's really true, because if you're decreasing the movement of that muscle, those lines aren't going to form. So really, I mean, it can be preventative. But I would say usually people around my age, I'm 39, that's when I see women really want it and start to inquire about it. So the main three areas I'm going to focus on that people mostly like is when you hear people say the 11s, that's this area right here. It's the procerus and corrugator muscles, and it's when we make this like frowny face. And again, I'll show that picture because as you can see, I can kind of make the face, but nothing happens. The other thing is the frontalis muscle or the forehead muscle. When we raise our eyebrows, these lines appear, and that's okay. I need to say that having those lines with movement is normal. That's a natural thing that our skin does. It moves with the muscle. If you look at a little newborn baby, when they make faces, they get wrinkles in their skin. So it's not a bad thing to have that. It's just if it's something that bothers you, we can treat it, or we can do something about it. Which leads me to another topic, which is a lot of times women will ask me, okay, what do I need? Where should I inject? If I inject here, does that mean I have to inject it there? My answer always is the same, which is whatever bothers you. I mean, if something, having these lines on our face, as I said, it's natural. I don't think, there's anything wrong with it. For instance, we have these little lines here that come, we call them bunny lines. Some people cannot stand having those lines there. They want them injected. They want them gone. Well, personally, I think they're cute, so I don't feel like I need to inject them, and I would never look at someone and think, oh, they have bunny lines, they need Botox. So it's personal preference. A year ago, I just started getting Botox recently, within a month ago, on my forehead, because I always said, I have lines, but they don't bother me. If they ever do, then I'll get Botox. And over the past year, this has started to bother me. So I got Botox, and now I love having a smooth forehead. It's just, I don't know, I just enjoy putting on makeup and having a smooth forehead. However, I do have all these crow's feet lines here, and I don't inject them because they don't bother me. They're there, but they don't bother me. Now, a year from now or a week from now, if I decide I don't like how these lines look, then I'll inject them. But that is my advice if people are interested, but they don't know what should they get done. If you have lines on your face, it doesn't mean you have to get rid of them. It's normal. But if it's something that bothers you, then it's something we can definitely treat. Risks include an allergic reaction, a headache. Headaches are not uncommon to get. They're temporary. You can have some pain at the injection sites, a little bit of bleeding, like a spot of blood when they inject it, and then a little bit of swelling. A lot of times you have these like little bumps that appear temporarily, maybe 10-15 minutes, and then it'll go down. It's something that people get on their lunch breaks. They get it, they go back to work, nobody knows you had it done. The main risk I feel like we hear about is a result of the product migrating to an area where we don't want it. For example, if it gets into these muscles that control our eyelids, it can actually cause a droopy eyelid or a droopy eyebrow. That is why you want to have an injector that knows how to safely inject, as well as discuss aftercare with you and things that you can do to try to help prevent those types of things. Sometimes they do happen though, and you try to be as safe as you can, but these are things that can happen. Cost. So the cost varies quite a bit based on where you live, and of course where you go. On average, according to the internet and from what I've seen, you're going to see somewhere between $10 and $15 a unit. I know that's a pretty wide range, but I mean, you could probably find both of those things within 15 miles, 10 miles of where you live. Both those costs. If you go to something like an event, you're likely going to pay a lot less. So that's, if you're looking to save money and that can be a good option. Also, keep in mind that you probably won't have as much time with your injector if you're going to an event where he or she is injecting 15, 20 people. So if it's your first time, I would just make an appointment and go into an office where you can ask questions and have as much time as you need, just so you know what to do, what to look for, that kind of thing. Also, to me, it makes more sense to try to stick with the same injector because they're going to keep track of where they injected and how much they injected, what worked, what didn't work, what you didn't like. So if you are just going to events to save money, you really don't know what you're going to get. So if you've already kind of figured out what you like, probably good to try to stick with one injector, you know, if you can. Pain is the last one. So unlike lip fillers, we don't use any kind of topical anesthetic for a couple of reasons. One is it honestly really isn't that painful. Filler is much more painful than Botox. And as I said, I don't find filler to be that painful when you're using the topical anesthetic as well as the lidocaine that we inject. But Botox, even less so. The needle is so tiny and you're going just under the skin. The whole thing takes maybe 3 minutes. The other reason we don't use a topical anesthetic is because it actually can diminish the effectiveness of the product. So I think that pretty much sums it up. I loved all the questions. Keep them coming. Anything you guys want to know, if I can answer, I will.